Kuzuzampo, welcome to Bhutan This Week, our weekly news magazine program with me, Sonampem. Our top stories this week. The red zone area in Phinsiling cordoned off for another 21 days. WHO Southeast Asia member countries signed the member states' declaration to fight COVID-19 as one. And Member of Parliament Dojiwandi elected as new opposition leader. The red zone area in Phinsiling, which includes the core town and the Dantak areas, is being cordoned off for another 21 days beginning from 3rd September. According to the Health Minister, the entire Phinsiling is still a risky area and movement in the cordoned red zone will be restricted and even delivery services will be minimized and strictly monitored.
54 cases from the Dantak cluster and a case each from the Agriculture Ministry's livestock storeroom and flu clinic means risk in the red zone Phinsiling is heightened. The red zone area within Phinsiling has been expanded.
아니기 낭고나기 사고나기 민옴디 배워진 땡아지 님 케치치 마조 춘수 딱신가네 메베세슈니 아니 님 케치치 주 두위기 님 딜레벤 딜랭아치기 아니나루 딱셰 배웅세슈니 따따 디나루 딱셰 베니기 데지데 아치마다 우유세슈니 디나루 다 사고 마비나 춘이디기 디나루 까라 민옴 유세집 땡아치기 딱셰 베니세슈니라.
However, if a person shows symptoms, he or she will be immediately tested. Meanwhile, in surveillance zones or yellow zones, which include Pemaling, Amochu Housing Colony and NHDCL Housing Colony B, the test for 4,600 people in this zone will be conducted beginning tomorrow.
아니 딱시 배위기 타임 디날레 땡아체 루미날레 niebubiumi chie mathen bewachin telete sago mapti deveradu tele sago safety te ta atazumbe yanyo se shunila.
However, if any new cases are detected from any of the places, then the particular area will be cordoned off separately as a red zone. Sharabdoji, BBS News.
Any stranded person leaving Phinsiling will undergo mandatory 3-day quarantine. The National COVID-19 Task Force endorsed this proposal of the Health Ministry on 2nd September.
The new measure will apply to those stranded people leaving Phinsiling and have to hold a night before reaching their destination. For places that are a day's journey away from the border town, travelers will be quarantined once they reach their destination district.
감선 냥카 봄치 ngacara sansam dadigi be benidigi te ani sansam dadigi tele high risk to low risk area gidi ngachigi lejum pe gunde thap sobachin tele the rest of the country can function as it is.
All stranded people will be tested for COVID-19 before they are released from quarantine facilities. Yesterday, 120 individuals arrived in Thimphu and Paro from Phinsiling and are undergoing the 3-day quarantine. The Prime Minister's office posted on their Facebook page that the additional days in quarantine and subsequent tests were instituted as reinforcement, although the individuals have already come through the 21-day lockdown. During a press briefing yesterday, the Health Minister also announced that wearing face masks is now compulsory.
Mandatory use of face mask. Karedi lalen tapna se. Ta karedi lalen tapta loy sultimbe lalen tapna se la. Ta lalugi ma ani thome la lalugi ani monkey repu lalugi chew repu be anebe me ma te karedi karebera. Piptae ngachara namchogi jab khale be anebe. Pida bachin te ngachi ani lejum be dance be sula.
Meanwhile, Minister Dechinongmo said compared to past years, this time there are fewer flu cases reported in the country given the use of face masks and other precautions like hand washing. This, the Health Minister said, has to be the new normal. Sharabdoji, BBS News.
Everyone visiting flu clinics will be tested for COVID-19 from now on. Rapid antigen test, which gives results within 30 minutes of testing, will be done in all 54 flu clinics across the country. All flu clinics are set up separate from main hospitals to avoid risks for the hospital.
Te chibe chatem na ane bewachin te ngachigi holegi seldepti te menkana atara menkana jodo zumbe te menkana jon mada seila de gachimo sawachin de chibe ata zumbe chatemchi na menkana awa chatemchi na ume dubachi chap mese doctor chu menkana anebe jobe te de chibe ani mingomdelu coronavirus wachin te menkana them thakale phake ta u seila de chibe keda wachin tele menkana ludi mi khara nani chani yumigi mi nepyu ngachara soigi lejab yube te anala phakya da bachin tele ngachigi benka di godam gop theu seihila
145 workers with the Jai Prakash Associates Limited in Punachanshu Project 2 finally left for their homes in India last week. The company arranged transportation. 5 vehicles, including 4 buses, left for India via Gallipoli and Finsling. There are 2,700 workers and about 1,000 want to leave. The company plans to send all of them within 60 days in phase-wise.
Eager to go home, workers once again gathered for confirmation yesterday. 145 workers were all tested for COVID-19.
We have been here for almost a year and our family members have been calling us. We have our own problems back home, but the company has been asking us to wait for months.
When we come to the office to request leave, they tell us to register. And we did that more than a month ago, but did not get our leave approved yet. That's why we are so worried. So about 80% of workers do not want to come back.
Some of these workers submitted their leave application about 8 months ago. They usually go on leave every 3 to 4 months.
About 2 to 3,000 people live and work together, so if there is an infection, it can easily spread. This is one reason that we're scared here. Moreover, several annual festivals are coming. We might be kept in quarantine after reaching home, and by then, we can take part in the festivals.
Frustrated, some 400 workers have even refused to come to work.
These workers are working with us for the last 10 years, 20 years, and they have worked with us in different projects. Even there are certain workers who have worked with us in Tala project. So they are not against the company. Their only requirement is that they should be sent to their homes in their native places because they have already completed enough time here.
Meanwhile, the managing director of Punachanshu Project 2 said if they can bring in new workers on time, there will be no impact on the construction. Jai Prakash Associates is constructing the dam and the powerhouse of the project. For Changadoji in Wandipoda, Sherab Doji, BBS News.
All member countries of WHO Southeast Asia region on 10th September signed the Member States Declaration to fight COVID-19 as one. The member countries resolved to collectively fight COVID-19 and strengthen the region's response with better equipped health systems to deliver essential health services during the pandemic. The 2-day virtual session ended on Thursday. The declaration called for efforts to ensure countries sustain essential health services and public health programs during public health emergencies. Accordingly, all member countries agreed on the importance of universal health coverage and primary health care as a preventive measure for people to access quality health services and other essential services, including the most vulnerable population. The member countries agreed to allocate adequate budgets to ensure uninterrupted services during and beyond the pandemic while prioritizing health of the people. Countries also resolved to strengthen health information systems by strengthening digital technologies which capture timely reporting of outbreaks and sharing information for policy decision. With health workers playing a crucial role in the pandemic, member countries pledged to ensure occupational health, safety and well-being of health professionals and other related workers. The member countries also agreed to continue and expand multi-sectoral collaboration, strengthen regional collaboration for scaling up capacities for preparedness, surveillance and rapid response, supply chain management of medicines and medical supplies, and regional stockpiling of essential health resources, among others. All the countries in the region also agreed to fully engage in global discussion on equitable allocation of vaccines, medicines and diagnostics for COVID-19. Sunampem for BBS News. With almost 91,000 new reported cases, India surpassed Brazil and became the second worst hit country in the world by the pandemic on Monday. Data with the Health and Family Welfare Ministry showed that as of 7th September, India has a total of 4.2 million cases and is nearly 70,000 cases ahead of Brazil.
The United States, with more than 6 million cases, still remains the worst affected country. India, for the second consecutive day, registered more than 90,000 new infections in the last 24 hours. According to the World Health Organization's data, India has been reporting the highest number of daily COVID cases in the world for nearly a month. However, more than 3.2 million COVID patients in the country have recovered so far. Over 69,000 recoveries have been reported since yesterday. This morning, the Health and Family Welfare Ministry reported 1,016 deaths, taking the total number of fatalities to almost 72,000. Similarly, cases are soaring in Indian states neighboring Bhutan. West Bengal saw 3,087 new cases and 52 deaths in the last 24 hours. The state currently has more than 23,000 active cases. However, the state is seeing an increasing number of recoveries from COVID-19. Almost 154,000 people are declared recovered. And in Assam, 1,537 new cases were recorded in the last 24 hours, taking the total number in the state to over 125,000. The state saw almost 97,000 people recover from the disease, although 360 fatalities have been recorded so far. Despite the surging cases and deaths, the Indian government today reopened metro trains in selected cities more than 5 months after it was shut down to prevent the spread of coronavirus. All preventive measures like using face masks, physical distancing and temperature checks were made mandatory. Meanwhile, coronavirus cases have infected around 27 million people across the world. The virus has so far killed 883,000 people. However, almost 18.1 million people have recovered from the infection. Sangeet for BBS News.
The preliminary examination of the Bhutan Civil Service examination has been scheduled to take place on 8th November. It was announced by the Royal Civil Service Commission on Wednesday. According to the RCSC, Bhutan Civil Service examination this year has been delayed due to the COVID-19 pandemic. It was mainly due to the late conduct of the final examinations and the delay in the graduation of candidates from various colleges and the lockdown situation in the country. Over 3,000 graduates appear for PE every year. The e-registration also started from 9th September. RCSC officials said they will be continuously assessing the COVID-19 situation in order to ensure the smooth conduct of the examinations and the safety of all candidates. The examinations will be conducted in strict compliance with the COVID-19 safety protocols. The main examination is scheduled for January next year. And for the first time, the Department of Agriculture released locally produced hybrid maize called Wenkar HM1 to overcome the impacts of climate change in the country. The new hybrid seed will be resistant to heat and drought, and it will also have a higher yield.
Agriculture officials inspect the hybrid maize. It is grown in over 60 decimal of land at the Agriculture Research and Development Sub-Center at Lingmithang. The research has been going on since 2015. And today, the seed has passed the test. The National Maize Program harvested 2 batches of Wenkar HM1. The third batch is being cultivated. The seeds will be supplied to Seed Center in Tashiansi for production and distribution.
As of now, National Maize Program has released 6 improved varieties since 1992 and the last one in 2015, and all these varieties are open pollinated varieties. This hybrid, the Wenkar hybrid 1, is the country's first ever hybrid to be released in the country, and it has a good resistance to both heat and drought. Moreover, it has a good yield potential of 1.9 metric ton per acre, which is way higher than the national average yield.
The Wenkar HM1 was identified in 2018 through evaluations carried out across the maize growing areas in the country.
Very soon we will be linking this program, seed production program, with National Seed Center through formation of community-based seed production. And ARDC will be responsible for carrying out capacity development of all the hybrid maize seed growers. Besides, ARDC will also be carrying out the maintenance and multiplication of parental lines, and we will also share the parental lines with other ARDCs in other regions, whereby they will also carry out seed production as well as maintenance of parental lines.
Till date, the maize seeds are being imported from India at a relatively higher cost. But soon, farmers will try the local hybrid seeds for increased productivity and food self-sufficiency. For Sonam Sring in Mongar, Kilidem, BBS News.
Gelifu FCB auction yard imported 9 metric tons of onions and 3 metric tons of tomatoes from India recently. It will be distributed to 8 districts across the country. To meet public demand, the government lifted its earlier suspension on its import recently.
The first consignment was delivered to Wandifota today.
And from here, we will be supplying to Dagana, we will be supplying to Tirang, Wangdi, Punakha, Shetongsa, Shemgang, and Bumtang.
The FCV plans to deliver the vegetables to respective districts on the same day of arrival to prevent the vegetables from rotting. The country has been seeing a shortage of tomatoes and onions after the government suspended its import following the lockdown on 11th August. For Kamwongdi in Gelifu, it came for BBC News.
The opposition leader Dr. Pema Jamso made his official exit from the office on 7th September. And Member of Parliament of Panbang, Doji Wangdi, was unanimously elected as the new opposition leader. 16 members from Druk Finsum Sokpa elected the new opposition leader through way of voting. At the official ceremony of the handing-taking, Prime Minister Dr. Lote Sring, the newly appointed opposition leader, the NA Speaker and members of the Parliament shared their thoughts, commitments and way forward.
This is the first time an opposition leader has stepped down from the post before the end of term. Dr. Pema Jamso, in his political journey, served as the Agriculture Minister for 5 years and as opposition leader for over 7 years. He is expected to join the International Center for Integrated Mountain Development as its Director General next month.
I will study how they are improving their economy, tourist management and disaster risk reduction from climate change mitigation and so on, and bring it here in our country. So from my side, I am not resigning from serving the country. One of the things I'm really proud of is I have no adversaries when I'm leaving.
As a farewell in appreciation of his service to the nation, Prime Minister Dr. Lote Sring expressed his gratitude and grief in losing a veteran of the field.
We don't have any ill feelings towards any opposition member, and all of us must be feeling sad because a parent figure is leaving the parliament. I want to take this opportunity to thank him for all the support, guidance, and for being a role model to us. We also have to work together in the future as well. ISIMOD is a field where we can draw a lot of support from, and we will hope that you extend your help.
Entrusting the leadership, the veteran MP will now steer the DPT and serve as the opposition leader for the next 3 years.
It is a matter of grief for DPT when such a person of his caliber is leaving. On the other hand, it is a great opportunity in ISIMOD. And as the opposition leader, I will endeavor to work and achieve like him and will not forget the primary objective and root of the opposition.
With the Chokortang constituency vacant, a by-election will be conducted. This is Sringdandup, BBS News.
10th September marks World Suicide Prevention Day, and observing it has become more vital given the COVID-19 pandemic this year, which has led to an increase in mental health issues. Keeping this in mind, the National COVID-19 Mental Health and Psychosocial Response Team launched a program to train more gatekeepers for suicide prevention in the country. Gatekeepers are ordinary and non-professionals who are in frequent contact with other people in the communities.
Suicide rate in Bhutan, like in any other country, is increasing steadily. Staying home, low physical activity, less socializing, and unexpected changes in the way everything works are some of the reasons contributing to depression and other mental health problems. Every year, there are around 100 cases of suicides reported in the country.
We do not know exactly for now how many people would have died by suicide, because the data are still coming in and we can't get online live data. But we also know that the lockdown, the quarantine and the COVID disease itself has created so much of fear, anxiety and also depression among the people. So obviously we expect that the suicide rate in the country will go up.
Although online counseling by the response team has helped the team to tackle people's mental health during the first lockdown, he said suicide cases are likely to increase if there is subsequent lockdowns in future. However, Dr. Tencho shares that suicide can be prevented and that mental health can be treated.
I have a very simple mantra, is mental illness can be treated and suicide can be prevented. Only two mantra, simple, but these are very profound. So mental illness can be treated. We can prevent suicide if you take the right steps, if you seek help at the right time. If family members, friends are more sensitive to the needs of your people, that you reach out to them, ask them what is happening to you. Can I help you? Something is bothering you. They should ask people. So these are simple mantras that anybody can follow. The worst situation is not telling anyone and you're brooding this whole thing, and then it becomes like a pressure cooker.
To mobilize the services from the response team, an online suicide prevention training program for all health workers, counselors and interested volunteers was also launched today. The participants, called gatekeepers, will be given skills and knowledge to recognize, intervene and link distressed individuals to appropriate mental health resources. Samtin Dolkar, BBS News.
That's all for this week. Thank you for joining us.